Recording. So good morning, everybody. It's Dana Brigman and Dr. Barb Fox, and we're back from a little hiatus that we took over the holidays. Maybe not intentionally, but we did. And today we're going to spend a little bit of time talking about aggression and a number of things that factor into that. But I'll first let Dr. Barb introduce herself, and then we'll move into our dialogue.
Well, thank you, Dana, and thank you all for being on this call. This is it's February. My gosh, I can't even believe it's out.
It's not almost
far into the winter.
It is.
Yeah, and so, like Dana said, I'm Dr. Barb Fox. I have been a veterinarian for almost 27 years now, and in about the last 14 years, I've devoted most of my practice to holistic medicine. I still do some integrative medicine, meaning that we use regular medicine along with natural therapies and products. And it was my own health scare back in 2007 when I had breast cancer, and I chose not to go through the conventional treatment for that. It really got me into wanting to find out how I could use these same things that I was doing for myself with my animal patients. And so it's been a brand new journey. It's been a wonderful journey. And Dana, how did we meet? I can't even remember. Would you just contact me because of a conference or something that we were at, or what? I can't remember.
I don't think I know the answer to that, but I'm so glad that we did, and I feel like I can call you a good friend at this point.
Yes.
I'm not sure what the first dialogue really was about.
Yeah, well, and it doesn't matter. I mean, we've had a lot of great conversations. So
yeah.
Anyway, that's pretty much in a nutshell who I am and what I'm about. I also have created some online courses for essential, safe, and effective essential oil use in dogs, cats, and horses. And then I have a nutrition course that I put together, and I have a mini course on vaccines, what you need to know as a pet owner. And then I do personal consultations, private consultations for people who have issues with their animals and they want a holistic practitioner to help them, and maybe they don't have anybody close to them, so we do telemedicine instead. So, and then I do speak and write for different publications and speak for different conferences and groups. So I'm kind of a spread out busy person, but I love what I do.
Yeah. Well, I'm happy to have you, happy to know you, and happy to have this conversation because I do the behavior work on aggressive cases all the time. And I think a lot of times we wind up with a mislabeled thing, and we sometimes wind up with people who don't realize how they are contributing to the aggressive behavior their dog has. So I think this is going to be a fun topic and hopefully extremely helpful to people as they put together the sort of veterinary side of things as well as the trainer side of things, and we can tell a story about that. So when you and I were talking about having this conversation, one of the first things we talked about was looking at a puppy and what can we do, in assessing their temperament and in sort of that puppy socialization phase that may help set the tone for their behavior as they mature.
Yeah, so one of the things that people do when they bring in a new puppy is maybe they're not real well trained on what to expect for dog behavior. And so we do have a little bit of how to potty train, sit, stay, that kind of thing. But veterinarians are not trained as behaviorists or dog trainers in general. I mean, we don't even have that. Maybe they do now, but when I went through my curriculum in vet school, we didn't have anything on dog behavior or training, anything like that. And so, but one of the things I do though is I do assess whether that dog, that puppy has a tendency toward being an introverted type of personality, an overt or extrovert, or if this puppy is going to have some aggressive tendencies. And some are really obvious. I mean, I've had 8-week-old puppies growl at me when I went to, look at them, hold them, even, when I'm checking their teeth. lift up a lip to look. And then I'm like, well, you guys need some professional help. And I don't even try to get into the behavior issue at that point. But I do say that this is not going to get better, this growling, this little aggressive tendency here, unless you get professional help. And I'm probably I'm too broad here, Dana, so bear with me, but I've even had the extreme case of, having to put animals to sleep or dogs to sleep because they've been biting too many people. And then it becomes where the city or the legal officials are saying, you can't have this dog here anymore, it must be euthanized. And I remember getting bit. I got bit by a Rottweiler on my forehead, and I had 16 stitches in my head. And I remember going to the emergency room to get sewed up, and they made me report the person. And unfortunately, it was owned by another veterinarian.
Oh no.
And yeah, so we go from the whole spectrum of looking at that puppy. Does it make eye contact with you? Does it stare down with you when it's in the exam room? And sometimes if you guys have ever been around a mean dog, even before it growls, just that look it gives you can feel your hairs on your arms standing up, or you get goosebumps. I've had that happen many times. And those are the serious cases. And I had that really tough talk with the client right then and there. It's like, you need professional help, or this puppy is going to be biting or attacking people.
Mm-hmm. So would you call that genetic aggression or something else? And the reason I ask that question is I've done a lot of fostering over the years, and I've seen a lot of puppies. And I would say it's rare to see something that I have described as a genetic aggression. And that was a puppy that at around 13 weeks old, he and his sibling, and I was fostering both of them, he flipped the bits and he became very aggressive toward his brother. So we initially thought littermate syndrome kind of thing. And so we separated them, but I saw this aggression progressively worsen. And literally one day I had this is when I was doing the board and train, I had a little white fluffy in a crate that had just arrived. And this other dog, Red, had been out for a walk or something. And when he came in, he saw a little white fluffy and literally launched himself on top of that crate and started trying to shred the crate to get to the puppy. And we spent another 6 months with multiple trainers, multiple approaches to training, and could not resolve that. Nothing we tried resolved his, what I would call this genetic prey drive aggression. And so I'm just curious your thoughts on the reality of that, or the description of that, and how often you see something along those lines.
Well, that's a good question, Dana, because I don't think there's any genetic test that you can actually perform, to verify that. But I have a feeling it's partly genetics. It could be partly genetics. And you always have that alpha in that alpha member of the litter. Right. And maybe we're seeing more of the alphas, exhibiting that type of behavior. But I think more environmental, food, medications. We start out these puppies, even puppies, most veterinary clinics start them out on heartworm medicine at their first visit, put on a flea and tick product, and then maybe have them on a high carb food. It's kind of like rocket fuel. Right. And if a dog or a puppy has a tendency toward aggression, this is just kind of like, for me, you're just fueling the fire. As far as genetics with, this, like what the scenario that you just mentioned, I kind of dive into things past genetics. Like, I'm probably going to sound a little out there, but bear with me for those who are listening that don't believe this, but there is a spiritual aspect to all souls. And I truly, in my heart, believe that animals have souls and spirits. Mm-hmm. And if there's something that's attached, some negative entity, or where they have a negative aura around them, I have a feeling this is another thing that is really hard to explain. But here's an example. I'm just going to use a horse for an example. There was a horse one time that I have a good friend who's a horse trainer, a natural horsemanship trainer. And he works with cases that people have given up on. And usually he can turn them around. Very few times has he ever not been able to help an animal. And this horse was charging and attacking the owner. And it was just a 2-year-old horse. And my friend took this horse on as a project and had gotten this horse to, like, when he carried the hay out into the middle of the arena, the horse had to stand and wait until Bob said it was okay to eat. I mean, this is kind of like you do that with your dogs too.
Like a resource guard.
Right. And so it took several months for Bob to get to that point with this horse. And then one day, out of nowhere, because he was getting along so well with this horse, he was walking away from the hay pile back toward the gate, and this horse came charging at him. And he said, I turned around and he says, I saw Satan. He said this horse's eyes were, and I mean, it was that horse meant to kill him. And Bob tried to get between two panels. It's really hard to explain, but he got between these two to keep out of the way of Ethan and hooves, but the horse crushed him in between those two panels. And Bob said, I thought I was dead. Now, long story short, Bob had some serious injuries, but he recovered from those. But he told the owner, he says, there's no way that this horse can ever be trusted.
Yeah.
And the owner agreed with him, so they had to euthanize him. Extreme case. But Bob said that the guy couldn't afford to have the rendering truck come and pick the horse up. So they had, like, I want to say 200 acres of timber and woodland and so forth. So he took the horse back there. This was in the winter, so couldn't dig a hole at that point. He thought he'd just leave it there covered until spring. Nothing touched that. Now, in this area that he lives in, there's coyotes, there are eagles, there are all kinds of predators that would love to have eaten that horse carcass. Nothing touched it. So right then and there, Bob's whole idea was like, this horse is possessed. Now, can we prove that? Obviously not.
Right.
But there was something there, and I've seen this in dogs, I've seen it in cats, I've seen it in almost all species. So there has to be some kind of spiritual aspect to aggression outside of a physical, or mental condition.
So, wow. I got cold chills hearing that story. And maybe this is going to be a different conversation than I thought we were going to have, but I was training a dog one time. In fact, I was fostering him, and he was young. He had bitten a couple of people in his family, and they didn't want him anymore. And so the rescue group that I was working with took him in. Beautiful dog. And I got him in a really good place, right? I mean, he was doing all the right things, and he was living a good life, and he was well behaved. And I sent him to a foster. We had talked about all the history and all the things that they were going to have to do to keep this dog safe and living, the way he needed to be structured. It did not go well. I don't know what they did. I got all sorts of crazy stories about how evil he was and all of this, just a whole bunch of stuff. And when I went and picked him up to bring him back, there was a darkness in that dog's eyes I had never seen before and have never seen again. He did not recognize me. And he had lived with me for months, but it was like, I don't even know how to describe that. There was sort of this empty soul there. He was just a shell of a dog with this hollow darkness in his eyes. And I could never recover him. I mean, he never recognized me. So we wound up euthanizing him. But I don't know where he went. And it's just the oddest thing. So your story makes me think that there's perhaps something I had never even considered happening within him that wasn't present, or I mean, it probably was present, but not identified early on. Do you know what I mean? That my thoughts
Right.
of he was great and then he wasn't, and the root of that being a very different cause.
Yes. Yes.
Wow.
Oh boy. It just, the more you find out about things, the more interesting and intriguing and
Yes.
almost scary at times it is.
Yes.
Right?
Exactly. And so it's interesting that you say the more you find out about things, and that's really where, or how I landed here doing all of this stuff, is because I was doing dog training and I had some of these really complicated cases, a lot of cases with anxiety, cases with dogs that bit, you know, and this term used very loosely called aggression. And I'm like, there's got to be some answers to this. There has to be something that we either as people are not doing in the socialization, in the training space. And it led me down this path of vaccinations and the effects that they can have on our behavior, and nutrition and the effects that they can have on behavior. And so it was in a essential oil class that I was taking where I heard Dr. Nancy say, aggression lives in the liver. And I was like, what? I don't even know what that means. And so I would, if you could maybe share a little bit about that, because I have come to believe and see it in action over the years that if I have a dog with aggressive behavior and I focus on their nutrition and perhaps a liver cleanse or liver supporting essential oils, that we get a better result in our training. So I'd love your thoughts on that.
Well, I'll start with the liver. As we all know or should know, the liver is the big detoxification vat in the body. Everything filters through the liver, the blood, all the blood in the body goes through the liver, and there it is kind of like cleansed and put back into the body. Very simplistic terms. In Chinese medicine, and I'm not a Chinese medicine expert by any means, but there are different organs, like the kidney stores fear, the liver stores anger, the lungs store grief,
right,
and the heart is our emotional center of our body. So if that liver is toxic from either medications, drugs, metabolites, poor quality food, you name it, bacteria, fungus, viruses, then it's not functioning well. It can't filter out these things. So what happens when you are toxic? You really don't feel well, correct? So these dogs that have what we call stagnation in the liver, or we have liver fire, these are Chinese terms, right, but one is more of a, it's just the different types of things that can happen with the liver. The dog's not going to feel very well, and it may end up in an aggressive or kind of a grumpy behavior. And so this is why it's really important to think about what we put into our dogs' bodies, through their mouth, through their skin, through their nose, whatever, because that all gets filtered out by the liver. And so you are, a lot of times, even if a dog has what we would call normal liver enzymes on a panel, but they are showing symptoms of toxicity. And the main thing is allergies, skin outbreaks, chronic ear infections. Things aren't getting filtered, so they're trying to come out through the skin. Then we need to look at, what are we going to do to support that liver? And you're right to bring that up, Dana, because that's a very important thing.
Yeah. And when I have that conversation with training clients, their eyes sort of glaze over like I am talking voodoo, right? It's because
join the club.
They come to me with a thought process of, my dog needs training. And seldom do they think they need the training as well, but rarely do they think that nutrition and vaccines and flea and tick medications and yard chemicals, air freshener, any of the, rarely is that even a thought process that could be affecting that dog's behavior in some way. It may not be the whole problem. And in fact, what I usually see is, even if that's a big component of the issue, dogs are smart, they're opportunistic, right? And they learn real fast where their power plays are, right? And so I think we have to marry the training and the nutrition and the cleanse or whatever it is all together and come up with a whole solution. And I mentioned earlier, I have seen where when we do that, the training usually is faster and much more long-term sustainable. In other words, if they stick with the plan, I am not getting those calls a year or so later going, we've regressed, we've had a big setback, or we've had a failure. I see much more long-term sustainable overall wellness.
Absolutely. Absolutely.
Yeah.
And that's one thing that people don't think about. And here's another case. So we have a dog that comes in, has got chronic skin allergies or skin outbreaks, whatever. And when I mentioned nutrition as the foundation for getting this under control, I still get that deer in the headlight look too. And people just don't put two and two together. Modern medicine has done a huge disservice, in my mind, of just treating symptoms and not getting to down why is this happening? Why is my dog getting the 5th ear infection in 6 months? It's those medications that we're giving our animals are just, like I said, simply Band-Aids. Takes the symptom away, it makes you feel better. Everybody wants instant gratification too. Right. So when we are thinking about detoxing that liver, or we're changing the nutrition, hoping for a better outcome with chronic conditions, it's not a quick fix. It's a marathon, it's not a sprint. And so we are so programmed, in the modern medical world is programmed to offer that quick fix. Here, you got your knee hurts? Oh, let's just give you some ibuprofen. I mean, why is your knee hurting? Do you have some cartilage that's damaged? Your body need minerals so it can kind of cleanse out the stuff that's sitting in that joint fluid, yada, yada, and that's the approach that holistic doctors or holistic veterinarians and naturopathic doctors take, is looking at the entire organism and not just focusing on one thing. So if we have that aggressive dog, why is it aggressive? Right. Is it in severe pain from arthritis? Is it getting a food that's not appropriate for it? Is the household so chaotic and there's so much tension that the animals are feeding off of that? And this is what we do. And this is, oh boy, I'm going down a rabbit hole here.
Go right ahead. But I like it.
But what happens is we end up with our animals that are suffering because we are not digging deep. And Dr. Nancy, you mentioned her earlier, she's got a really good, it's about a 30-minute video on her website. It's called Dig Deep. And I encourage everyone to get on there and watch that. But boy, I don't know, we can go through a whole lot of scenarios here, but as a practitioner, Dane, I was just going to say, very rarely do I, as a holistic practitioner working on my own, doing consultations, I do get those behavior challenges. Sure. And I do fill in for a couple of conventional clinics now and then as a relief veterinarian. And it keeps me, in the modern medicine world so I can see what's going on. And I also get a chance to talk to people about nutrition, essential oils, herbal products, homeopathic remedies, and that kind of thing, because the conventional practitioners aren't going to do that. But what happens is, here's a case of where the client doesn't even know they're doing anything wrong. We have a dog that comes in to the exam room and immediately starts growling. And I'm not going to be picking on either gender here, but I'm going to say, because most women during the daytime bring their dogs in, not the men. What does the female client do, but she immediately puts her arm around the dog. Oh, it's okay. It's okay. It perpetuates that aggression then. It's okay. Oh, mom says it's okay. I can go ahead and growl all I want. And then what do we have to do in a busy veterinary clinic? We slap a muzzle on it, restrain it, and do what we have to do. It's not teaching the dog anything.
Right.
So I think that client education with behavior and dispelling that fear aggression. I see a lot of fear aggression or territorial aggression. So I don't know where you want to take it from there, but gosh, I could just go on for hours, I think, on this whole thing.
Yeah, me too. Days even. In fact, I love to do like weekend workshops where we talk about nothing but aggression and how to work through those things. I love it. But one thing that I'll say before we move into the next sort of piece of this is, don't wait, people. Please don't wait until you see an aggressive behavior show up. And hopefully they never will. But all these wellness things that we're talking about, think proactive, whether it's proactive for health or proactive for behavior. The more we can do that, the better all things will be. So, Dr. Barb, I see a lot of clients with aggression. It's kind of my thing. Behavior, anxiety, aggression are sort of my top two issues. And aggression, of course, has many, many layers to it. But I often go to the client and their dog is on some prescribed medication from the veterinarian who thought that medication would resolve the behavior. Can you tell us about those meds and why that might be the school of thought from the traditional medicine world?
Absolutely. Here again, going back to the quick fix. Everybody wants a quick fix. It's easier to slap a pill down this dog's throat than it is to get to the root cause of why that dog is behaving the way it is. That is my huge pet peeve with everything. Behavior related, because like you said earlier, Dana, most of the time it's environmental or the way that these dogs are raised in a household that stimulate this abnormal behavior. And I'm just going to go through a couple of the things that people prescribe. I tend to see a lot of separation anxiety cases in the vet clinic, and people are wanting, is there something I can do to take the edge off my dog? And there are very few extreme cases. Now, my brother actually had a Brittany Spaniel at one time that they ended up having to put to sleep because he was killing himself. I mean, he would chew through the most indestructible kennels. He broke out of a basement window one day and tore himself all to pieces. I mean, it was like an extreme case, and I had worked with him, so I knew it wasn't that.
I've had clients where the dog sails out of 2-story windows, literally sails out the window. Wonder it hasn't killed himself. And after the second time, they're like, okay, we need some help. And we were able to deal with it and get things significantly better. Not perfect, but significantly better and safe. So I'm sorry I interrupted you.
No, this is why I love the interaction here, because it'll stimulate me to think of something else too. But the two main drugs that are prescribed by veterinarians for behavior issues, whether it is aggression or separation anxiety in general, whatever, is Prozac, which is fluoxetine. That's the generic for Prozac. We call it puppy Prozac. And then clomicalm, which is clomipramine. Clomipramine was a drug that came out. It's an older drug. It's a tricyclic antidepressant in the human world. So it's used mainly for anxiety and even, I would say, separation anxiety mostly. Prozac is used more for behavioral issues, especially aggression. And the Prozac is what we call an SSRI. It is a selective serotonin reuptake inhibitor, meaning that it controls or tries to balance the amount of serotonin in the body. Now, these vets promote these drugs a lot because they want to be the hero. Okay, so if the behavior gets better, who's looking pretty good? The vet is, right? I hate to say it, I'm not trying to slam my colleagues, but I've got a lot of like-minded colleagues on my side too.
Yes.
Let's get to the basis of why that aggression is happening, the anxiety is happening. But we have to think about this. This is Clomicalm, and I looked right on their website in the drug insert that the veterinarians can read. It can cause lethargy and depression, vomiting and diarrhea, liver enzyme increase. It can also,
Not good.
It can also cause seizures, and increased heart rate, increased water drinking, and confusion. I don't know about you, but I wouldn't want any of my patients experiencing that. And then Prozac, which is
can I just interject? Think that through for a second.
Yeah.
A dog that is already displaying aggressive or anxious behavior, and now you give them a drug that sort of makes their head funky and confused. How are they going to respond to that? I don't think it's going to be good, right? I just don't think it's going to be good. In every case that I've ever done where a dog had some prescribed medication for their behavior, I'm like, call your vet, wean them off before you come see me. And the people are like mortified. They're like, we don't want to. And I'm like, I want to see the real dog. I don't want to work with some masked version of who he really is. And then that's how we've been able to work through the right issues to resolution.
Right. I'm glad you mentioned that, Dana, because I've had people that have been on Prozac for themselves and saying, I have no emotion. I'm not happy. I'm not sad. I'm just kind of like, ugh. I'm like, what kind of life is that?
Right.
But anyway, I was just going to say a few of the side effects of Prozac. Sedation. We want our animals sleeping on us. Anorexia, which is decreased appetite. Sleeplessness. And increase in aggression at times. It's very uncommon. It's a very rare side effect, but it happens, and also seizures. So to me, I'm sorry, I forgot one thing. Serotonin syndrome. Have you ever heard of that?
I can't tell you that I have. No.
Okay. I really haven't heard. I've heard of it, but I didn't know what it was. But this is a potentially life-threatening. It's extremely rare, but it can happen. If you are using, say, like tramadol, and then you add Prozac on top of that, that can cause the serotonin syndrome. Either in other drugs, tramadol is very commonly prescribed by veterinarians for arthritis pain and pain in general with animals. Right. So you also have some flea and tick products that can interact with Prozac and cause this serotonin syndrome. But I've never heard a veterinarian talk about it.
Right.
And so I wonder how many side effects from these drugs are occurring because of interactions with other products that are going on that are full of chemicals.
Right.
Just my thoughts.
What do you think of trazodone as a pharmaceutical for some of these types of issues? I know a client today that's what their dog was given.
You know, I haven't used it enough to have a strong opinion of it. I have seen it dispensed, but I'm one of those. I want to see a lot of animals on it before I'll even think about dispensing it myself.
Yeah.
So it's a fairly new one, at least.
It's just not our animals.
Yeah,
we're going to try the holistic stuff first.
Well, exactly, and I don't know if you want to move into essential oils yet, or is that down the list farther?
No, go ahead.
Well, this is where essential oils shine when we're talking about brain activity, brain function, emotional issues, behavioral issues, because essential oils are a living product. They come from the plant and they have a living vibrational frequency. Now, vibrational frequency sounds maybe a little woo-woo, little voodoo, but essential oils with this vibrational frequency is what keeps us healthy.
Mm-hmm.
Okay, so for example, our bodies, our human bodies resonate or vibrate at about a frequency of 68 to 72 hertz.
Mm-hmm.
And if our bodies fall down to like the 48 level, we're pretty darn sick.
Right.
And at 42, we can die. So when we take a pharmaceutical, it does nothing to increase the vibrational frequency of our bodies. Our bodies have to bring ourselves up on our own. But if we're too sick to be able to do that, then we need some help. Now, essential oils, some of these like blue spruce, Idaho blue spruce has a frequency of, they think, 428 hertz. Now think about that. If you're breathing that in or if you're putting it on topically,
Mm-hmm.
what's it going to do? It's going to raise your frequency to the level that it needs to be. There's a Northern Lights black spruce that is thought to have a frequency of over 500 hertz.
Mm.
So when I am working with a patient that has anxiety, maybe they have a little cognitive dysfunction going on, perhaps the dog is old and it's getting a little bit less likely to focus on things, then I'm going to be using these oils with high frequencies to help that animal.
Right.
The beauty of the essential oils too, Dana, you can see how passionate I am about essential oils. But the beauty of essential oils is when a dog breathes them in, dogs have tens of thousands, maybe hundreds of thousands more nasal receptors in their nasal cavity than humans do. That's why they have such a keen sense of smell. And because of these receptors taking up the essential oils and taking it into the blood, where it goes right into the brain, and it goes into that area of the brain called it was where the limbic
system.
sorry about that. Yes, which is made up the hypothalamus, the hippocampus, the amygdala, and the pineal gland. That's the center. The pineal gland is the center of your emotions. And so the tiny, tiny size of the essential oil molecule allows it to cross the blood-brain barrier, which a lot of medications can't cross the blood-brain barrier because they're too big and the body rejects it. So when a dog breathes in an essential oil, it's almost immediate. And I'll give you a really good story on this. When I had my physical practice still open, and I've closed it so I can do more telemedicine and reach more people that way. One of my good friends brought in her boxer. She had this boxer for a couple of years, the same as Cupid. And Cupid was always great in the clinic. She would just, lick your face, just curl up. She was just a wonderful dog. And then I hadn't seen Cupid for several years, and the owner called me. Her name is Nan. Nan called me and said, "Hey, Barb, I really need some help." I said, "What's going on?" And she started to cry on the phone. And she said, "I think I'm going to have to put Cupid down." I said, "Why? What's going on?" "Well, she's bitten my son. She's bitten my husband. She's bitten one of my son's friends. And I can't trust her anymore." I said, "Oh my gosh, well, bring her in and I'll look at her." In the meantime, Nan had filled me in on some personal issues, and I won't go into all of them, but basically she was going through a divorce. Mm-hmm. I wrote about this in my one book. She was going through a divorce after 25 years of marriage, and the family was in utter chaos. So who was taking on all the chaos? Cupid was. Mm-hmm. And her way of showing her disappointment and her disgust for the whole situation going on in the house was to bite people. So at that point, I sat down on the floor. I had a carpeted floor in my office, and I had my essential oils case with probably 75 oils in it, sitting right next to me open. And she was clinging to Nan. She wouldn't come off of her lap. And so I just would send an oil over to Nan and let Cupid smell it. And I did this about with 10 different oils, not even putting them on her, just letting her smell it. And in about, I want to say 10 minutes, she gingerly jumped down, walks with her tail tucked between her legs over to me and curls up in my lap. I'm sitting cross-legged on the floor. And then I was able to put essential oils on her topically and letting her smell. And the last oil put on, I actually was putting it on my hand to pet her with it, was lemon. She licked it right out of my hand. Animals, dogs especially, know exactly what they need.
Right.
And she would make a face because lemon is kind of sour, and then come back and lick my hand more. At the end of the session, she was wagging her tail. She was happy. And Nan says, I haven't seen her like that for weeks.
Mm-hmm.
And then I did a follow-up with Nan a couple months later, and she said, Cupid has never bitten anybody ever again. Now, could I have done that with conventional medication? No.
Right.
But it was an emotional release. The oils helped the emotions entrap or become unentrapped, I should say,
Right.
from that pineal gland and any other organs where those memories are sitting. We have cellular memory. So you can look that up. That's a scientific term.
Mm-hmm.
So for those of you who think this is a little woo-woo, I totally get it. I was there at one time. But you can look up cellular memory and find out what that means. So going back to, I don't know how we even got started on this little story, but I'll tell you what, how essential oils are so powerful so quickly.
Yeah.
There may be some homeopathic things, detoxification programs that we could have done. And I did talk to Nan about changing Cupid's diet, but it takes longer. So that testimonial right then and there, where this dog went from growling when I walked into the room to coming over and licking me on the face and sitting there in my lap, it was a huge change.
So you're making me want to put different oils in my kit when I go to a client appointment. Yeah. I think it's amazing. And let me just ask this for the people listening, because they may be somewhere in the world, right? Or somewhere in the United States that they are doing a telemedicine conference with you or a consult with me by phone. And we can't experiment. Like, I've got hundreds of oils all around this house and in my car and everywhere. What can, like the pet parent who's not begun with essential oils yet take away from this? And where might they start? I'm not saying, and I don't think you're saying, and even though it's mentioned in our desk reference as a topic of aggression and a whole bunch of oils that show up there, none of us are saying that is to the exclusion of veterinary care or behavioral care when necessary. But what could a pet parent take away from this to begin at home?
You mean as far as essential oils, Dana?
Yeah.
Okay. Well, first of all, I recommend starting with a guide. When I started with essential oils, even as a veterinarian, I had no idea what they were. I had no idea what they were about, except for going to different classes and so on and so forth. I knew pretty much what I needed for myself, looking in the human desk reference guide. When I had that cancer scare, this is what I turned to. I basically, I was ordering probably $600 to $800 worth of products a month. I did not go through chemo and radiation. I only had the lump out of my breast removed, kept all my lymph nodes, kept all my other tissue. But I had to know which oils worked best for my condition. That's where the desk references come in very handy. Mm-hmm. And then after that, if a person is open-minded enough, or has maybe seen a chiropractor do applied kinesiology, which is a fancy name for muscle testing, I muscle test for the oils or the products. There are other devices like a Zyto device or an Itovi scanner that can be used to figure out what frequencies your body is harboring in different areas of the body. It's a really complicated algorithm that they use in these devices. It's kind of like a biofeedback machine. And then it lists a report of things that you need. And sometimes I will do that. But I've trained myself through a chiropractor teaching me in different workshops how to use either your hands, your fingers for muscle testing, or if you prefer like a pendulum or a dowsing rod, you can figure out what your body needs or your animal's body needs. So that's where I teach my people to start. And then I would encourage them, there are holistic conferences. There's going to be one in October in Las Vegas again called the Holistic Health for Animals Conference. It's the 3rd annual one this coming fall. There are a lot of good Zoom calls that you can get in on. The problem is that with anything that's labeled as naturopathic or homeopathic or what am I trying to say, holistic, we have to be very careful because the FDA does not want us comparing these to drugs because they're not drugs. And we can't really say publicly, you know, XYZ can help with ABC.
Right.
So we have to be a little more inventive in how we word things. I can say, like, frankincense oil will promote a healthy immune system. I can't say it's going to kill cancer cells. But the desk references, and if you go online to different websites, like there's one called, it's pubmed.gov, you can pull up a ton of scientific reports using frankincense oil for cancers.
Right.
And it doesn't make any difference if it's human or animal. But yeah, and then there's also resources like the Veterinary Medical Aromatherapy Association. A lot of essential oil leaders in certain companies will have their own like little local or regional conferences. So, you know, word of mouth is great too, but that's where I teach my people to start.
Right. And I would just add to that, you know, even if you pick an oil or two and you start working with it, you may need to try something different. Right. Don't look at it and go, oh, it doesn't work and just give up. Right. That might not have been the right one for your pet or for yourself. And that's where, you know, working with someone like Dr. Barb or myself for the behavior can offer you some things to try and to experiment with versus going just this random shopping list, you know. But I don't want people to think, oh, I've tried this particular oil or this particular blend that somebody told me about and it did not work, therefore oils do not work. That is not how they work. It's not the case.
Right. So, well, and I think, Dana, it's really important to even if a veterinarian isn't well versed with behavior issues, let's get the medical causes ruled out.
Right.
One big one is, you know, pain. Pain can cause even the nicest animal to nip or be grumpy. Let's rule out a thyroid condition. And I know you said you've had tons of experience with these dogs about 2 years of age. They start to exhibit signs of low thyroid issues, which I believe with a young dog, we can have vaccines that can be implicated in that. Maybe some of our flea and tick chemicals or flea and tick preventatives, heartworm products, maybe not a good food causing that thyroid to not function well. And that's what we call like a sick euthyroid syndrome. If there's something else causing the thyroid besides an autoimmune condition, which is another common issue for thyroid. But I tend to see thyroid issues causing behavior issues and not being recognized. So that's why we need to get these blood tests done and rule out the obvious before we just start throwing everything and saying, well, that didn't work, or, you know, I give up. That kind of thing.
I typically always suggest a medical workup before we do anything, because there could be something. Like I'm working with a little pug now and his dad's a chiropractor. And I'm like, you need to give this dog a chiropractic adjustment. He said, I work on people. I'm like, figure it out. This little guy.
Right.
Because you can look at when he sits, how his little hips splay a little bit. And I'm like, that's part of his issue.
Mm-hmm. Right. Mm-hmm. So if our animals can't just verbally say, hey, my back is killing me. But if you notice how a dog normally would sit, and if your dog is splaying a hind leg out and sits like that, you know there's pain.
Yeah.
And I would just implore people to get to know your dog a little bit better. Mm-hmm. Even hearing impairment in these older dogs, if they're not hearing well and they get all of a sudden there's a loud noise and they're not recognizing that, they can turn around and nip or bite really hard, and they don't mean to do it. They're just startled. Right. Epilepsy or seizure disorders can cause behavior changes and biting. brain tumors. And one that we don't think of very often, but if you're breeding, if you're a breeder out there and you find out you've got that bitch that has just whelped a litter of puppies and she's being aggressive toward her puppies, sometimes it's low calcium. And that can cause behavior issues as well. So those are the main things that we look for. There are probably all kinds of diseases, say like diabetes with low blood sugar, that can change, or high, it doesn't make any difference if it's insulin, too much insulin, not enough insulin, too much glucose, not enough glucose. Hypoglycemia or hyperglycemia can cause behavior changes. And so we can't just get mad at our animals so we figure out, right, what's making them be different than what they normally would be.
Exactly. Don't give up until you've sort of explored all of these things. I know we're running low on time, but I do have one last question about the rabies miasm, or what some people might call rabies rage. Have you ever experienced that?
I personally haven't experienced that, Dana, but I have had clients tell me, I mean, I'm not actually seen it, but I've had clients tell me, my dog's behavior changed right after he had his rabies shot. What's that all about? I've had, yeah. So for those who aren't familiar with what this rabies miasm is, it basically is an animal who has all the signs and symptoms of rabies. Maybe the aggression, the drooling, the lethargy, maybe some paralysis, but usually a huge behavior change. Maybe they're wandering around the house and they're vocalizing. They're acting like they don't know what's going on. But if you test them, they do not have rabies. Right. So this is like a really odd phenomenon that occurs following a rabies shot. And unfortunately, it can last for a long time. It can get over with very quickly too. But it's one of those that the problem with the rabies injections, the rabies shots, is that there is no state in the country, in the whole United States, there's no state that recognizes a rabies titer as proof of immunization. But they will accept the rabies shot as proof of immunization. That means that you might be able to give a rabies shot to a dog, but does it mount a proper immune response or not? We don't know that. Right. But if you have a blood test and the blood test shows there's circulating antibodies to rabies, that's proof. It's so crazy.
It is.
And I don't want to get into government politics and all that stuff, but there is a handful of us that are working to try to get this changed.
Yeah. And I hope we do.
And the other thing is, I'm sorry, I just want to inject one important little thing here, is that I'm going back to rabies. I just lost my train of thought. Oh, for immunization of animals, the rabies, any vaccine insert says that only healthy animals should be immunized, meaning vaccinated. Now, you've got the 15-year-old dog that's dying of cancer. Technically, by law, it's supposed to have a rabies shot. Mm-hmm. Now, there's some states, unfortunately, where I practice, Iowa does not recognize rabies titers. They do not recognize a medical exemption, but there are certain states that will take a medical exemption, say like you have the animal that should not be vaccinated. Hey, it's okay. We don't want to harm this dog. That's the way it should be, in my mind.
Yeah. Okay. Any other thing that you would like to add before we wrap up?
Oh boy, I could go on for days.
We may have to do aggression part 2.
No, I just was going to say too that some of these medications that we're giving our animals can cause behavior issues as well. Yeah. And I don't have a list, but potentially any of them can cause the side effects of having behavioral or mental changes.
Right.
Okay.
Yeah. And I when I first heard Dr. Nancy say aggression lives in the liver, I tried for myself. And so I would use essential oils over my liver and went on about my business, did this whole little protocol. And I didn't tell a soul what I was doing. And a couple weeks in, they said, we don't know what you've done, but whatever it is, please keep it up. Because I was less snippy, less likely to fly off the handle, less irritated about a bunch of stuff. And that was when I was a real believer in the power of all of these things. So for those people that are listening, and if you have a dog with an aggressive behavior, there are some that are easily resolved with the right sort of approach to nutrition and wellness and leadership from the people. And then we have those dogs that can be really very dangerous. Please seek out professional help from somebody who can coach you through pulling these pieces of the puzzle together and coming up with a strategic plan to help get them well. We can't save them all. I've put down more than a couple of dogs that, I just tear up if we're going to talk about that. That's a whole nother conversation, but that they just could not be saved. No matter how long and how hard we tried, they were unhappy, they were unhealthy, and they were putting too many people at risk. So.
Right, exactly. And Dana, I was just going to wrap up one more thing here. For those of you who are interested in consulting with me, I do have some criteria. You know, telemedicine requires certain things for my state license as far as medical records. So if somebody's just searching, doing a Dr. Google, thinks their dog has X, Y, or Z condition, I have to have documentation that exists before I can work with them. Also, I only work with, if you're interested in essential oils, we have to remember that quality is the top priority, is the utmost priority, because there's so many bad oil companies, bad oils out there on the market. And I only use one company. Dana, you also use it. Do you want me to talk a little bit about that? Just mention that?
Yeah, you bet.
So Young Living Essential Oils is a company who's been in business for about 27 years. I think it's their 26th or 27th year. Is the only company I trust with animals, or even myself, my own family. And they have been in business for a very long time, and they have a boatload of veterinarians that use the products, myself included. I've been using them, my animal patients, for, like I said, 14 years or so. And I only work with people who want to use these. If you want to use essential oils, I only work with people who are Young Living people, and preferably I like them to be working with a Young Living leader of their choice. So in other words, Dana, if you have somebody approach you or you approach them about Young Living, and with this can help this or that can help that, I stay out of the picture. All I'm doing is I'm helping put together the pieces of the puzzle. I am not out there to promote those oils. I want you to work with them, and I want others who have worked with essential oil people to work with that person. That's how we do teams. We're a team, okay? I'm just the doctor. I put together things, and so that's how I do it, okay?
Great. And I actually sent a referral your way this morning, so I hope she will call you.
Oh, okay, great.
For her dog as well.
Okay.
Yep. So, all right. Well, thank you so very much again. Friends who are listening, we're going to try to resume this on at least a monthly basis. I've already scheduled Dr. Barb a little bit into the future. And thank you so much for your time and your expertise. And I can't wait for everybody to keep learning more from you. So have a great weekend, and we will chat soon. Oh,
thank you all.
Yep. Dr. Barb's website is barbfoxdvm.com. Go look her up, take her little online classes, and schedule a wellness review with her if you need it. We'll talk soon, everybody. Bye.
Thank you. Bye-bye.
Now, if I can stop. Hey, listen, everybody, it's Dana Brigman, and I want you to be on the team. I want you to use essential oils and nutrition for your dog's wellness, whether it's puppies or aging, skin conditions, allergies, aggression, anxiety, serious diagnosis. Nutrition and essential oils are the way to go. They will help with everything. And I want to be your coach. My goal in this is helping you have healthy, thriving, happy dogs for very long lives. I don't want you to wait until you are in a crisis or you're feeling desperate about trying to help your dog recover from something. Get proactive, get involved in learning as much about this wellness approach, this natural wellness journey as possible. Even if you start with baby steps, just please start. If you're ready to get going with Young Living, I would love to be your wellness coach and your sponsor to get started and help you with your education and get you involved in some of the groups that are doing even more education for the entire family. If you are already using Young Living and you're needing consulting on the animal side of things, I'm happy to do that as well. But if you're using Young Living with me as your educator and sponsor, your consulting calls with me are at no added cost. And the same is true if you begin using the Volhard products. Your nutritional and support for those products or nutritional needs is also at no added cost because you're using those products through my affiliate program with Volhard. So join the team. Your dog is counting on you to give them the most natural lifestyle possible, and you'll be really happy that you did.